Alright guys, this is going to be our last video, our fourth and final video. We're jumping right back in with intradermal injections as a form of our parenteral medication administration. So where do we give intradermal injections? They are given anterior forearm, halfway between the wrist and the elbow. So we can see here in this picture, her elbow bend would be about right here and her wrist is here. So this is the anterior part of that arm, and they can also be given on the back below the scapula. The advantages to giving intradermal injections: the hair is sparse in these areas, it's not over a bony prominence, veins and arteries are not as close to the surface, it's very slow absorption of very small amount of medication, excellent for testing allergies and TB exposure. And here, when we give intradermal injections, the angle of injection is going to be 10 to 15 degrees. So we'll see here, that angle between the arm and how she's actually injecting is very, very small. So it's not like she's coming in from way up here and going straight in. There's a very slight angle to how she's injecting this medication. The maximum volume allowed for intradermal injection is 0.1 milliliters. This is tiny, guys. So a very, very small amount. The needle size is going to be 25 to 27 gauge. Remember, the bigger the number, the smaller the needle. The length of that needle is going to be 3/8 to 5/8 inch. That needle does not need to be very long because we're not going very far into that skin. The syringe size, we only need a 1 milliliter syringe because we're only going to put 0.1 milliliters inside of that syringe. The patient needs to be seated with arm support in the instance of using this. If they're going to do it on their back, we probably have them seated up in a seat with no back or on the examination table. So examples, we've already said this, but purified protein derivatives, that PPD, test for TB exposure, and allergies or allergen sensitivity testing. So that's our intradermal injection. Reminder, please watch these videos as your homework prior to our skills practice. So IV injections. Here we're going to, anatomical sites for IV injections often done in the hand, forearm, our antecubital fossa, which is our AC often called. That's the inside crease of our arms, very popular site for IVs. And dorsal venous arch of our foot. Not as common, not usually suggested, but you can do an IV there. So here we see this intravenous injection, this IV, in the patient's hand. So advantages is ease of access to superficial vessels with limited risk of damage to nerves and easily differentiation of arteries. So we're using a vein, not an artery, and veins are more superficial. They can be damaged. We can actually blow a vein, but it causes very little risk to any long-term damage by accessing these veins. It's very rapid, so rapid in action due to the distribution by the bloodstream. So once this medication is placed inside this IV, it is directly in their bloodstream. It's going to be working almost instantly. So when we do an IV injection, that angle is going to be a little bit higher than our intradermal injection. It's going to be about 25 to 30 degrees insertion. So 25 and 30 degree angle of insertion. The maximum volume, there's no limit. However, the rate of infusion is based on the medication and the purpose of the infusion. So we can put as much medicine into that IV as we want. So a bag of fluids is 1,000 milliliters. We can put that much in there. Plus, we can do multiple bags of fluids if we want. How fast we give it into that vein is based on what we're giving or putting into that vein. So some medications need to be given 30 milliliters an hour, some different. So it's all calculated as to how fast we give medications IV. So for needle sizes, usually we do about 20 to 24 gauge needles. In the ER, our go-to needle is a 20 gauge. For those coming in with shock or any kind of trauma, we're going to get a larger bore needle that's going to be a little bit bigger. So an 18 gauge needle would be more appropriate, but for the most part, 20 to 24 gauge is okay. You may go smaller with a 26 gauge if the patient's pediatric, preemie, those kind of things. And usually it's 1 to 1.5 inch needle length. Syringe as large as needed to dilute the medication to be administered. So we can use a syringe. So I guess I should note this. When we start an IV, it doesn't have a syringe attached, right? So this is talking about medication administration. When we're talking about a syringe for medication administration, we just need a syringe large enough to dilute whatever medication we are giving through this IV. Usually the patient is going to be seated or lying or reclining when we start an IV. And examples of things we may be giving intravenously would be antibiotics, morphine, Benadryl, Ativan, fluids, all different kinds of things can be given IV. Subcutaneous injections. Let me just back up here 1 second. Note that MAs are not allowed to start IVs. You do just need to be familiar about intravenous injections and how they're done. Subcutaneous injections. These we will be doing. MAs can do subcutaneous injections. The sites for these are going to be the abdomen, at least 2 inches away from the belly button or the navel. The posterior aspect of the upper arm. So we'll see in this picture, this patient, this is the back of the arm there. The upper and outer thighs. So these areas are fatty. We're looking for subcutaneous tissue. We are not going to the muscle. We are going into the subcutaneous fat, subcutaneous layers. So the advantages, thicker fat layers, ease of access, versatile, can be used for short or long-term therapies, slower absorption of medication up to 24 hours. So a little bit slower than our IV therapy, but still a little bit different than how we give oral medications. The angle of injection here is at 45 degrees. So remember for our intradermal, that was 10 to 15 degrees, right? For our IV, 25 to 30. Here we're going at a 45 degree angle. The maximum volume is going to be 1 to 2 milliliters. Needle size, 25 to 27, a little bit smaller needle. 3/8 to 1 inch. So again, not too long because we're just going to that subcutaneous level. The syringe size is going to be about 1 mil to 3 mils because our max is going to be 2 mils. And then the patient positions, they're going to be seated or supine. Remember, supine is on your back, depending on the injection site. Examples of subcutaneous injections would be heparin and insulin. So probably the most common you'll see is insulin. Insulin is given subcutaneously, and you may be teaching patients how to give themselves subcutaneous injections. Intramuscular injections. Reminder again, guys, watch all of these videos because you need to be familiar on what we're going to be practicing for our skills. So all intramuscular injections are going to be done at a 90-degree angle. I want to note here, this is not necessarily a 45-degree angle in this picture. So let's not kind of do as this picture is doing, but note that this is supposed to be a 45-degree angle. 90-degree angle for our intramuscular injections. 90-degree angle. Sites for intramuscular injections will be the deltoid. So here is the picture for the deltoid. Mid-axillary line, so right in the middle of that armpit. 1 to 3 finger breadths below the acromion process. The acromion process is that bony prominence at the top of your shoulder there. You're going to 1 to 3 finger widths below that. The max amount that deltoid muscle can hold is 0.5, so a half to 1 milliliters. We're not giving any more medication than that. So if you have an injection of 2 milliliters, you cannot use that muscle. Needle sizes. 23 to 25 gauge, 5/8 to 1.5 inches. Only site approved for the hepatitis B vaccine. Only site approved for the hepatitis B vaccine. This is often our most selected site for injections, intramuscular injections for vaccines. Most often used, unless we're doing the pediatric patients, infants will use their thighs. Dorsogluteal, so upper outer quadrant of the buttocks. We're going to look at a picture of all these in just a second, but this is the upper outer quadrant of the buttocks. So just like our abdomen, we can divide a quadrant up into 4s. So if you divide the buttocks, so just one butt cheek, into 4 areas, the upper outer area is going to be the dorsogluteal. And here we can give up to 3 milliliters. So it's a larger muscle. It can get more medication in there. Needle sizes, 20 to 23 gauge, so a little bit larger of a needle, 1 to 1.5 inches, a little bit longer needle because we've got to get it all through that fat to the actual muscle. Ventrogluteal, this is a different part of the gluteus muscle. We'll talk about this when we look at Simon. We'll kind of talk about all of these different sites. Not used as commonly anymore as the dorsogluteal, but also another part of the gluteal muscle or the gluteus muscle in the buttocks. Here, same as the dorsogluteal, 1 to 3 milliliters, so again, large muscle mass. Same goes for this. It says the preferred site for IM injections. We'll differentiate these two in class, okay? And just, when we meet, I'll be able to describe where the difference is in these two. Vastus lateralis, one hand breadth below the greater trochanter and 1 hand breadth above the knee. So you take one hand and put it above the knee, one hand right below the hip joint. Right in between there, you're going to get your sweet spot in that thigh. So it's on the outer edge of the thigh, that meaty part, that the kind of more muscular part. Also has fat above it. Here you can do 2 milliliters. The needle sizes are 21 to 23 gauges and usually about 1.5 inches to get past all that fat. This is appropriate for all ages. Infants, this is where they get shots. My infant daughter, all of her shots so far have all been given there in the thigh, the vastus lateralis. So all of those were just words for you guys. I'm sure you're like, wait, where are all these sites? So here is a picture for you. The vastus lateralis that we were just talking about, that thigh. Again, 1 hand breadth here, 1 hand there, 1 hand below the hip. This is our sweet spot. That's where in the thigh you can give that injection. Middle third of the vastus lateralis muscle, right here. That arm, that deltoid muscle, this triangle, 1 to 3 finger lengths below that acromion process, right? That's where we're giving that. The hip, the ventrogluteal. This is more so noted as the hip. Here, I guess we would just say hip instead of buttocks. This is our hip. This is the one that's most commonly used. You're going to place your hand on that greater trochanter, so that hip bone. You're going to place your hand on that hip bone. Put your hand up on the hip. Find a space between your fingers there, right there. That's going to be your injection site, ventrogluteal. It's that hip area. It's kind of hard to differentiate between the hip and the buttocks. But I want you to kind of focus on these pictures. And again, on Simon, I'll be able to more specifically tell you where exactly they're located. The dorsogluteal site is, remember we divide the buttocks into 4 quadrants here, upper, outer, 4 quadrants. I'm dividing this buttocks into 4 quadrants, upper, outer, right there. All right. So again, guidelines for administering injections. So we had our guidelines for medication administrations. This is going to be just some guidelines for injections. As always, follow the 6 rights. Always evaluate each patient as an individual. So, everyone's different shapes, sizes. So sites might be a little bit different on each person. Select the needle syringe unit that is appropriate size for the type of medication and site you're giving. Correctly prepare the appropriate equipment and supplies. Wash hands and put on gloves. Select the correct site for the intended injection. And it's about to cut up on me. So you guys read the rest of these guidelines, okay? Remember to watch your videos. Prepare for our quiz, okay? Email me with any questions you have. review this video, watch those videos in the